Good afternoon, everybody. My name is Louise Elstow. I am from the Centre for Sustainable Development at Cambridge University, and I'd like to welcome you to today. This is the first of our series of webinars looking at climate adaptation within healthcare, healthcare systems and networks. I'm delighted to welcome you to today's webinar. We've got some great speakers coming up, so bear with me one second. I'm just going to share my slides. So PEACCH is a project looking at climate adaptation within healthcare, and we've developed this series of webinars as a project, a collaborative project between Cambridge University, Anglia Ruskin University, Yorkshire Ambulance Service and Mid and South Essex. And it's funded under an Impact Acceleration Award through the UKRI's Economic and Social Research Councils and the Engineering and Physical Science Research Council. So today's is the first in our 4 webinars. We'll be first of all having a look at taking a quick look at what adaptation actually is, taking back to us back to some of the first principles about what adaptation is, what climate change is, how it links in with climate mitigation but is different to it, and some of the steps that you can start to take to think about climate change adaptation within the health system and some of the impacts that it will bring. The second webinar, which we've got coming up on tomorrow, is going to be looking at heat risks more closely. That'll be from 12 to 1. We've got some great speakers coming on. We've got more great speakers coming up on Monday next week, where we'll have a closer look at flooding and drought risks. So that's everything to do with too much water, not enough, and water quality. And then finally, on Wednesday next week, we'll be having a look at tools for embedding climate adaptation within your own organisations and how you can start to take the learning from the first 3 sessions forward into action. That's a slightly longer session because we've got a number of the different things that we want to have a look through. So that's from 12 to 1:30. It's an hour and a half. You can use the QR codes here on the screen to book yourselves into any of the sessions that you haven't already done so for. We'd love to see you. Also, the sessions will be recorded as this one is going to be, and therefore we'll make those and the slides available to you after the session so you can share them with colleagues and relook at them if you need to. So I'd like to now go through the programme for today's session. After my brief introduction, I will take you through an introduction to climate adaptation. As I mentioned, what is it not? How does it differ to mitigation? How can we think about potential co-benefits between mitigation, adaptation and other things like biodiversity. And I'll give you a brief overview of the kinds of interventions that we can make and the way that we can think about intervening to achieve adaptation. Alexis will then take us through a focus on adaptation within the health sector, so thinking more specifically about the impact on the health sector of those climate-driven risks that we're concerned about. And what to think about those in terms of the short, medium and long-term impacts. We'll then come over to Federica Pasquale, who will be giving us a run-through of research research projects that are investigating climate adaptation within the health sector in particular. And then Neil Cartwright from the NHS England Greener NHS team will be talking us through some recent changes to climate adaptation policy and an introduction to that policy landscape within the UK setting. As I mentioned, we'll also have a short Q&A session at the end where if you've got any questions, we'll be happy to take those then. So without further ado, I will go straight into the introduction to climate adaptation. So first of all, what actually is climate change? And it seems like a really basic thing to start with, but I thought it's probably good to take us back to basics. So when we're talking about climate change, it refers to these long-term shifts in temperatures and weather patterns. So although they can be natural and we do have regular changes, particularly in the UK, in our weather in any given day or week, we're talking about these long-term patterns. Although the changes can be natural, such as, and they can be brought on by the changes in the sun's activity patterns or large volcanic eruptions that can, for example, block out solar energy. Since the 1800s, it's been recognised that our human activities have been driving this change in our climate, and this is primarily due to the burning of fossil fuels such as coal, oil and gas. So this increase in greenhouse gas emissions starts to act like a blanket being wrapped around the Earth, and it starts to trap in heat, which over time is causing rising temperatures. And the main gases that we're concerned about, although they're not the only ones, are carbon dioxide and methane. So then thinking about climate adaptation, what does this mean? So climate adaptation is all about taking actions to reduce the negative impacts of climate change. So it's about accepting that there are certain changes that will take place, and we need to be able to identify those changes, identify the impacts that they're going to have, and start to build resilience to those shocks and stresses. So when we talk about shocks, we're talking about short-term, very acute events that might undermine a system's capability to do something. So in this sense, the health system. If we're talking about stressors, that's more long-term, chronic stressors that are sort of gradually undermining the ability of the system to perform. So climate adaptation can include changes in processes and practices, and also the changes to the physical environment that we're doing things. So we can change the way that we're doing things, and we can change the spaces in which we are delivering healthcare. And adaptation can mean mitigating potential damages. So if we say, talking from a risk management perspective, mitigation just means limiting. So we're limiting the potential damages that climate change can have and as well as thinking about seizing the opportunity. So there might be different ways of doing things that actually are beneficial to the system because of this changing climate. It's not necessarily only negative impacts. So when we're thinking about climate-driven risks, and I know that various speakers will probably touch on this again in their own individual sessions, we're probably talking about things like floods and extreme weather events. So the main climate-driven risks to the UK include those floods, extreme weather, extreme winds and rain, but also things like increased wildfires, which bring with them water quality and air quality issues. But also when we're thinking about heat, we're not just talking about heat waves, so acute events, but just general increases in temperatures over time. So we've spoken already a little bit about storms and extreme wind, air quality issues. We'll also be thinking about water, not only in terms of having too much of it, but we might be thinking about water scarcity, so water in the wrong place or not enough water, and also the sea levels rising. So a lot of these impacts or a lot of these risks might be operating together to combine to produce a very unpleasant environment to work in. So it's worthwhile delineating between adaptation and mitigation, but also showing where they overlap. So it can be useful to think about them as two separate things, distinctly separate things, but also to understand that they do relate to each other. So we've spoken about adaptation, meaning the ability to anticipate the negative impacts of climate change, and also to anticipate some of the positive impacts, and to take action to start to prevent the negative impacts or to take advantage of the positive impacts. Mitigation, on the other hand, climate change mitigation is about taking steps to reduce our carbon emissions and to make climate change less severe by preventing or reducing those emissions. So there are a number of different interventions that you can take, and they're symbolised in this visualisation here on the right, which shows that there are different activities you can take to adapt and to mitigate. But there's this big overlap in the middle where a lot of what we're doing, for example, installing installation, can reduce our energy bills, can reduce our carbon emissions, but also they're really good for addressing extreme temperatures outside. The same with local food production, reduces our need on external supply chains, but also reduces the amount of carbon emissions to move that food around. So you'll often see that there's co-benefits between both of them. It isn't necessarily one or the other, but it's important to recognise that the benefits operate in different ways and for different reasons. So I've spoken before about shocks and stresses, and this diagram can be really helpful. It's from the Climate Change 2022 report on impacts, adaptation and vulnerability from the IPCC. And it shows, particularly on health systems, how overall these stresses, the chronic stresses that we might have from people migrating, from chronic water shortages over time, from political instability. All of these things are undermining the ability of the health system capacity to perform at its normal capacity. So it's slowly being driven down. Then if we get a shock event, you'll see that there's further disruption, there's significant disruption. And that means that your performance or your ability to deliver your health services will be further shocked and more significantly. But what we want to do is to get us to think about what we can do to adapt to reduce that dip. So reducing the impact of overall chronic stresses if we can, and then to reduce the reduction in capacity over time. So if we do it well at this, we can go from potentially just absolute collapse at the bottom. We could move up to recovering, but we're not going to get back to where we were before. That sort of green phase of recovering to where we were before, or perhaps a little bit better. Or if we've got transformative healthcare adaptation and resilience, then actually we come out of this much better than we were before. To be transformative, though, we need to take some fairly drastic steps in thinking about things and where we are spending our money. So when we're thinking about climate adaptation, it can be really useful to think about it from, or at least to start to think about it from a risk management perspective, because climate risks are one of many risks that a health system will be addressing. But this is because of the way that we can break it down. We can see how we can start to intervene to reduce some of that risk. So if we think of risk as being the intersection between a hazard, something that might cause or do some harm to something or someone, or a process, that needs to be thought of in concert with exposure to that hazard. What is being exposed or who is being exposed? Are there particular sites or people who are going to be exposed to it more than others, or other things? And vulnerability. Are there particular populations or particular bits of critical assets or processes that are going to be impacted by this hazard? And so if we think about risk in those as a combination of those three things, something that can do you harm, something being affected by it, and a particular predisposition to be affected by the impacts of that risk, then we can start to sort of think about different ways of intervening. So we can intervene to reduce our exposure to that risk. So we can start to protect particular sites or people so that they are less exposed to that risk. Or we might reduce somebody's vulnerability or a thing's vulnerability by providing it with additional coping mechanisms, or reducing the impacts of that thing on them or on that site. So physical adaptation can look like many things, and part of the project that I was working on before, Life Resistal, we looked through at all different kinds of physical interventions into the physical space that we've got. And I know that we'll be covering these in more detail in relation to heat risks and flooding and drought risks, as different interventions will operate in different ways to address those different risks. But it's useful just to have a brief overview of some of those physical interventions. So we might be talking about things like green roofs or walls. We might be looking at improved drainage, so thinking about the way that we move water in and around and store and manage water in our hospital and healthcare estates. Those things can be engineered or they can be nature-based. So if you see NBS, that means nature-based. And that means integrating greenery and plant life into the different things that we're doing. And the same thing goes for screening and shading. You can either have engineered solutions, so physical shutters and things like that on the outside of your building. You might have curtains on the inside, but you also might plant trees or greenery close to windows to produce that screening and shading effect. We might also think about ventilation and how we move air and air in and around our buildings. There are some particular challenges in the health sector with this in terms of infection and prevention control. There are also different ways that you can do this that might require additional energy, or that might be passive. So passive and active. I've already spoken about moving water through, but also if we're moving things around, we might be thinking about where we get our water from. Is it all from a water supplier, or are we able to harvest rainwater? We also might be looking at the ways that we are sealing the buildings in that we have, so and what the glazed entrances and windows that we have in our buildings, how well insulated they are, if they have reflective films on them. And that also then taps into things that you can do to reduce glare from other buildings coming in through those windows. So we can paint surfaces either with white or white paints, or we might choose different kinds of paints and surfaces to start to reflect glare elsewhere. Other things that we might do is protect particular escape routes or critical functions and services. So this might be around escape routes, escape doors. It might be around protecting your critical infrastructure internally within your building. So making sure that your supply areas and your electricity supply and data servers are protected. You might also think about adding redundancy and backup systems to them so that they're able to withstand or be more self-sufficient on their own. We might also think about how do we take steps to make sure that these infrastructures are less impacted by things. For example, we might not be able to necessarily reduce the likelihood of flooding, but we might design where things are in a building so they're less likely to be flooded, or that if there is flood water in there, that we can quite quickly pump it out. Another thing that we can do is to think about the layout of the building and think about how we can design and configure in reconfigurability, so where things are in a building and how it can be moved around. So apologies for the size of the writing on this. Don't worry, we'll share a copy of the slides so you can have this in more detail to look at later. But it's useful to think about different kinds of interventions that you can do. So if we think about the top three here, these are all non-structural interventions. They don't affect the buildings that we're in. They affect the processes and the people that we've got and what we're doing. So we might think about interventions in terms of governance and institutional arrangements that help support getting adaptation done in the proactive sense, and then in the reactive sense, also thinking about how to make appropriate decisions during critical events and acute events, ensuring that lessons are learned afterwards and things like that. From an economic and finance perspective, there are interventions that we can do, for example, having good insurance in place, ensuring that there are funding schemes to support adaptation, procurement and purchases and investments in there. But also we can think about what reactive economic and finance interventions there are, and that might be things around ensuring that there's funding for recovery action should you need to address it, and that there's funding to take action to implement interventions ahead of the next time that happens. Knowledge and behavioural change is all about people within the system. So it's about making sure that our members of staff are aware of what climate change is, aware of how it can impact their working life, aware of how they can take steps to change things, and how it affects their job roles in particular. And that will be in things to do with changes in consumption patterns, the changes to how they opening and shutting windows, or different things that you might want to teach them around responding to emergencies, for example. So there are different, again, reactive and proactive interventions that you can take. The second two here, the second group are a structural group. So again, we've got physical and technological. So these are things like early warning systems, mapping, physical infrastructure and other sector-specific innovations. So these are looking at the physical environment and trying to look at how we can start to retrofit them in advance. So taking many of the steps that I identified in the previous slide and implementing them into your physical environment. So changing the physical environments that we're working in. There are also reactive interventions for that. And then if we also look at that, I highlighted that many of the interventions that we can take, there are engineered solutions, but there are also nature-based solutions and ecosystems approaches. So as I highlighted, those things tend to incorporate greenery, plants, And they include things like green infrastructures, tree covers, improving soil structures and things like that. And again, there are steps you can take proactively. They tend to be proactive rather than reactive. And generally, it's considered that if we take more proactive interventions, then the impacts that we are dealing with and that need reactive interventions will be reduced. So the consequences will be less great if we take more proactive steps to address these. So I've mentioned proactive and reactive. Okay, and now we're going to go on to our first speaker. We've got Alexis Percival from Yorkshire Ambulance Trust, who's going to be talking to us about healthcare impacts of climate change with a specific focus on what climate adaptation means for health services. So over to you, Alexis.
Thanks, Louise. So as a way of introduction, I'm the Energy and Sustainability Manager with Yorkshire Ambulance Service. Next slide, please. So when we look at the impact on climate change, on our health system, we can see a variety of different things. When we look at climate change, it can come in different guises. It increases rainfall, but it also increases through heat waves the chances of drought. And also we've got longer term sea level rise that is also impacting us. Those cascade down into various other things. So through this series, we'll be looking at flooding and the impacts of that increased rainfall, which can come in many different guises, from flash flooding, surface water flooding, groundwater flooding, and the trickle down of that. But also with increased rainfall comes more storms and more high winds, which can translate into tornadoes and hurricanes. Heat can also come with different impacts as well, through an increase in temperature, which can impact the ground, but also can impact the air as well. And through drought, we can have more impacts through dust, through water restrictions, and the longer term impacts of sea level rise. We're looking at about 1 metre to 3 metre sea level rise by the end of this century. And the IPCC and the UK climate projections of 2018 have predicted by 2300 we're looking at a sea level rise of potentially up to 13 metres. So all of those have a direct impact on our health system. And we can look at loss of life as a very extreme element, but there could be elements that will also impact the health system through energy security. Those impacts will change and through various different elements of mental health impacts, injuries, hypothermia, infections, waterborne diseases is something we're looking at in longer term, with an increase in vector carrying insects. But also we have other elements, from cancer to antenatal complications through heat stress and dehydration, also will have that longer term impact as well. So next slide, please. So the impacts that we're feeling now are changing how we should and we can operate. But we are feeling an increase in number of heat waves. Wildfires are also impacting us through breathing problems and smoke inhalation, as well as an increase in asthma. Floods are also giving us an impact on the amount of access to our patients access to the health system. And also we having a direct impact, especially within the ambulance service, on emergency response times. There's also sea level rise and storm surges are playing a role as part of that flooding. We're also seeing an increase in the number of pandemic opportunities through COVID, and going forwards there will be more and more different types of pandemics will also impact us as more of the tipping points that will change the dynamics of some of the permafrost in different parts of the world, and we could unearth many different types of pandemics, as well as that movement of people bringing pandemics across the world as well. But also we're seeing a rise in the amount of climate anxiety and mental health challenges that come from the impact of climate change. Next slide, please. So when we look at our longer term impacts, we need to look at what our global policies are now. And with the various different COPs, there have been various promises, but we need to plan in for longer term aspects. So when we look at temperature, by 2070, we're looking at an increase in temperature during the summer and also an increase in winters. So we're looking at potentially a 3-degree temperature rise by 2070. But we're also looking at a decrease in rainfall during summer and an increase of rainfall during winter. And the cloudiness impact will also have a direct impact on the number of admissions into hospital that we will be looking at through a decrease in the amount of access, people coming into hospitals, but also we've got an increase in windiness, which will come through injuries in different types of wind incidents from falling trees and falling different things that we've got. But we need to plan for a longer term impact. So when we look at, next slide, when we look at that impact from worst case scenarios, we could have higher temperatures in summer, we could have a higher increase in winter temperatures as well, a larger decrease in rainfall, which will lead to droughts in winter, in summers, and also a larger increase in rainfall during winters, which will lead to more flooding. So next slide, please. When we look at the impacts that we have to deal with within the health system, we have to look at the mental health issues, we have to look at rise in skin cancer. Heat waves will lead to more heart attacks, breathing issues, COPD and asthma through an increase in the amount of dust storms and pollen. But something that is a bit of a ticking time bomb is the insect and vector carrying diseases that we've got. So things like dengue and malaria, which are set to hit UK shores in the next 20 years potentially. But also when we look at more flooding, we are set to have an increase in the amount of malnutrition due to our lands being flooded longer, the movement of food around the world decreasing due to failure of crops. But also heat waves will lead to dehydration, kidney issues, and potentially fetal abnormalities as well. And as I mentioned, the pandemic and infectious diseases are set to also have a big impact on our health system. Next slide. So when we start to look at that longer term plan, we need to look at that impact from heat waves, from wildfires, air quality, flooding and coastal erosion. Next 5 to 10 years, we're looking at more respiratory problems, more injuries. We're also looking at things like cardiovascular disease increasing. We're looking at illnesses and injuries and more drowning or flood related incidents, as well as people entering water during heat waves and getting into trouble. There's also some of the issues that will affect our staff and our patients, which is public transport disruption, bent railways, looking at roads melting. We've also got a rise in the amount of heat that will be trapped within our cities. Buildings will perform differently in wet weather as in hot weather. So if you haven't got the insulation in, we need to understand how our most vulnerable will suffer. But also air quality is set to change with an increase in windiness and an increase in movement of weather patterns as well. So the outdoor air quality will could decrease with the amount of dust, and as we've seen with Saharan dust storms as well. So if we move to the next slide, we can see that the next 10 to 25 years, there's going to be more and more increase in infection diseases and more bacteria, viruses, fungi and worms that will be impacting us. So we're set to have a rise in the amount of aspergillus issues that come from wet, soggy crop products like hay. That it's historically has been called farmer's lung, but it could affect a lot of different other types of crops. There's also lots of different things will come in 25 years plus, and you know we're putting timeframes on these, but in reality these could be a lot sooner with hotter temperatures. We're set to have an increase in the amount of microbial resistance, which will directly impact people not being able to recover from a lot of issues when they've been in surgery or within our health system. There's also health outcomes which will come from malnutrition, as I mentioned before. There's different issues associated with houses and mortality due to damp. We've seen a rise in the amount of black mold within buildings. So there's a lot of ticking issues that we need to understand, and we also need to understand how we deal with those within our health system. So part of the adaptation is understanding how we educate ourselves and how we build a more resilient health system. Next slide, please. So I'm going to lay this out for you. I think for everybody, we need to understand who our most vulnerable people are. They are babies, they are people over 75, over 65 in some cases, pregnant people. We're looking at those that are economically or socially marginalised. We're looking at those that work outside, anybody with chronic and underlying conditions, drug addiction, mental health issues, physical or learning disabilities, people in care homes, people in urban areas, people in high rises, but also homeless people. So at any one time, we could be any of these people. And we need to understand that if we build a health system that deals with the most vulnerable in our society, we can support all of us going forwards.
So now we are going on to our next speaker. So we are delighted to have on Dr. Federica Pasquale from Anglia Ruskin University. She'll be talking us through healthcare adaptation research and providing an overview of different research projects that are addressing the issue of climate adaptation within the health sector. So Federica, if you'd like to share your slides, over to you.
Thank you, Louise. Let me share my slide. Can you confirm you can see my screen as well?
I can, yes.
Brilliant. So thank you, Louise, for the introduction. So today we will go through some research insights on healthcare adaptation. And specifically, I would like to present some completed projects, some projects which are still ongoing, and future research calls on climate adaptation. So let's start with the completed project. One project which really deserves to be mentioned is DDREC, which stands for Design and Delivery of Robust Hospital Environments in a Changing Climate. This project was funded by EPSRC, was completed in 2012, and was led by the University of Cambridge. So the aim of the project was to investigate the design and delivery of economical and practical strategies for adaptation in the NHS within the state to increase its resilience to climate change while meeting the onerous carbon targets reduction for the NHS. The project has delivered several outputs. And in particular, they used two case studies to develop a short movie, which is very informative. You have the link here on the slides if you want to watch it. So what did the researchers did in this project? So they examined the thermal conditions in NHS hospital buildings built between the 1930s and today, and predicted their future performance until 2080. After assessing their strengths and weaknesses, the team proposed costed refurbishment options with a focus on infection control. So their key findings included, firstly, refurbishment can significantly reduce energy use and cost, helping the NHS meet carbon reduction targets. Secondly, naturally ventilated refurbishments can effectively handle extreme summer climates. And lastly, refurbishment costs are comparable to new constructions. Let's move to another completed project, which is Life Resistal, which stands for Climate Change Resilience Framework for Health System and Hospitals. So this project aims to ensure that health infrastructures across Europe are prepared for the impact of climate change. The project worked with 7 pilot hospitals and 2 healthcare systems across Europe and developed hands-on and universally applicable tools and resources. If we look at the outputs, the project is providing healthcare facilities with tools they need to chart a course towards resilience. So the project has published 3 essential deliverables, each playing a unique role in navigating the complexity of climate adaptation. Together, these deliverables act as a GPS navigation system, guiding the healthcare facilities on their journey to climate resilience. The first delivery helps to supply the map, the second helps identify the obstacles, and the third helps to chart the route forward. In addition, as procurement plays a crucial role in enhancing the resilience of healthcare system, the Rife Resistant project has created 2 publications, Procuring for Adaptation, incorporating climate adaptation into healthcare investment decisions, and Guidelines for Greener Procurement in Hospital, which provides actionable strategies to transform procurement into a pathway for improving healthcare resilience and sustainability. The adaptation part was led by the University of Cambridge, and Louise was also part of the project. Let's now move to current research projects on climate adaptation in healthcare. Ensure HRE stands for Integrated, Sustainable and Resilient Healthcare Real Estate, is my fellowship project, which was funded in 2022 by the Healthcare Improvement Study Institute at the University of Cambridge. The project aims to develop a framework to provide hospitals with integrated mitigation strategy to transition to a zero carbon future by 2050, and adaptation strategy to address existing climate change through better informed facility and built asset management planning. The research adopts a research methodology called participatory backcasting, which is a methodology for long-term planning that includes development of a desirable future vision, followed by backcasting analysis to elaborate a pathway towards that vision. The project, as I said, focused on the retained estate, and the first step of the research, the strategic problem orientation, focused on identifying factors that will drive change for future hospitals, which were identified through a scoping study. These results were then discussed during an interdisciplinary workshop to develop a vision of the sustainable and climate resilient hospital of the future. Once the vision of the hospital of the future was completed, we had 2 workshops with facilities management team in the partner trust to adapt that vision to existing hospital estate to set future scenarios and development performance specification. In the next step of the project, combined mitigation adaptation strategy will be backcast to ensure that the asset would meet its target over its lifetime. And the last part of the project is to develop the framework. The project has produced already several outputs, 2 conference papers presenting the drivers for the hospital of the future, a paper published on public health on the vision of the hospital of the future, and 1 published on facilities on existing hospital journey into the challenges, explaining the challenges and the barriers and opportunities estate and facility management are encountering in the journey. HARF stands for the National Research Hub on Net Zero Health and Extreme Heat, and is one of the 7 new interdisciplinary research hubs funded by UK, RI, and NHR to ensure that health is central to the net zero strategy. In particular, this hub will explore ways to ensure the UK transition to net zero also protect and promotes physical and mental health. It's a partnership across different universities. The hub has just started, so I will encourage you to keep an eye on their results. Let's now have a look at future calls on climate adaptation, which you may want to be involved. One is unfortunately expiring today, and is the NHR Climate Change and Health, Adapting Health and Social Care System is a development award where they are aiming to create research teams that they can then be supporting for further research. The other one is the bucket of local climate change adaptation on health and health inequalities. This is part of the PHR program and seeks to commission a single consortium to conduct a series of research projects for up to 5 years to address the link question between climate adaptation and health. So to conclude, there is a clear need to develop research initiatives focused on climate adaptation within the healthcare sector, highlighting the increasing urgency to support healthcare and decision making. Today, we have identified completed and nearly completed research projects that aim to create practical strategy for adaptation for the NHS retail estate, ensuring resilience in face of climate change, hands-on, universally applicable tools and resources, including streamlined procurement process to enhance efficiency, and comprehensive frameworks to keep hospitals with integrated mitigation adaptation strategy, informing effective facility and disaster management planning. Additionally, we have pinpointed newly initiated projects that will investigate how the UK's transition to net zero can safeguard and enhance both physical and mental health, and upcoming funding opportunity that will support this initiative in the future. Thank you for your attention, and I believe we will take questions at the end.
Okay, well, welcome back, everybody. We've got our final speaker on this, our first webinar for the PEACCH series. And I'm delighted to introduce Neil Cartwright from NHS England, from the Yorkshire and North East England region. He's the Net Zero Programme Manager, and he's going to be talking to us about the wider landscape of what is going on at NHS level around adaptation. So Neil, over to you.
There we go, brilliant stuff. Fabulous. Louise, thank you for inviting me to speak. As you've just said, I'm Neil Cartwright. I'm Net Zero Programme Manager for the North Eastern Yorkshire region for NHS England, and I'm a bit obsessed with climate adaptation. So I do feel like sometimes that I am the doom merchant when asked to present. I am the private Fraser in terms of presentations, but the reality is we are facing unprecedented circumstances. This graph shows us that it's not just the temperature that we've got, climatic temperature that's increasing, but also our oceanic temperature. So the ocean is a buffer in terms of being able to moderate the effects of climate change, but as we know now, year upon year, ocean temperatures are also increasing as well. So I mean, the key thing for this is now that the 10 most recent years are the warmest years on record, and as I stand here now, we've just been through the hottest spring on record, and yeah, it's not going in the other direction. So how's it going is the title of that slide. Not great would be the answer to that. I'm an emergency planner by background as well. I was emergency planning lead for my previous organisation, and being in that EPRR role, our Bible really is this. It's the National Risk Register, which for the last few years, the National Risk Register, the front cover, the last edition of it had flooding in York, which is on my patch. In fact, that picture on the top right there is flooding in York. This is the current version of the Risk Register. Again, very obviously, climate is an issue on there. In terms of those risks within the National Risk Register, climate's considered to be a chronic risk. So there's a split between acute risks and chronic risks, and we've got climate change. So the risks and impacts of climate change, of flooding and overheating and drought, are considered to be chronic risks in there. And typically, as emergency planners, we would work within local resilience fora to take this National Risk Register and translate it into our local context. So for me, I live on the south bank of the Humber. The risk of flooding from the Humber, from ingress from the sea, is obviously far greater than where I was born and brought up, which was on top of a hill in Derbyshire. So we need to take these national risks, and we need to look at them through the lens of the area that we live on. So picture at the top right is York, so flooding from surface water flooding and river flooding as it reached its banks. Top left is it's London, actually. I think that's Hyde Park. But obviously, and we're going through something like that at the moment. I think everywhere you look, the grass is completely parched. Bottom right is agricultural land. As I travel across the region, as I do periodically, particularly over the winter period, this is what I see from the train window. If I go across to really where my mum still lives in Derbyshire, I go across through Lincolnshire, Nottinghamshire, that sort of Trent area. This is what the fields are looking like. So the impacts of flooding on agriculture are significant. Bottom left is a photograph of Saddleworth Moor. So this is on fire. This is and the challenge from this as well is, as this fire was taking place, respiratory admissions in Manchester, which is where the prevailing wind was blowing, increased as a consequence of the fire upon Saddleworth. So this is what the impact is for me in terms of, can we continue to run our services? Are we able to continue to operate our buildings? What's happening in terms of hospital admissions? What's the impact of health services? This is really interesting. So baked into our language in the NHS is this thing called winter pressures. And everybody knows this phrase, winter pressures, winter pressures. We prepare during the summer, this alleged downtime, in order to gear up for winter pressures. This is recognizing that we are going to see more admissions in winter as it's colder, and then we start to see pressure on the system, pressure on the emergency departments, pressure in terms of ward occupancy, pressure on primary care. What this is showing us is particularly the 2020s, the 2050s lines on here, is what the potential is for something that very much looks like summer pressures. So as we have a gradually warming climate, we will start to see, as you'll see on the left-hand side of the lower graph, a gradual diminishing of winter pressures, so milder winters. But we're going to see a consequential increase in summer admissions as well. So at the moment, we can talk about winter pressures. I think we're going to start to see in our NHS lexicon summer pressures, almost like a perma pressures, but summer pressures taking place as a consequence of this additional heating and the impact that that's having on our communities and on our services. We did a emergency planning exercise in South Yorkshire a couple of years ago, very much based around our experience of heatwave from 2022. So we ran this multi-agency South Yorkshire Local Resilience Forum exercise, and what was really interesting as we were planning that exercise was we were speaking to agencies about, okay, so what happens during a protracted heat wave? And one of the key things that surprised me was we talked about water shortage. We talked about water shortage in the context of our reservoir levels. The interesting thing for me is the projected shortages that we talked about in that exercise, we're now living this. So we know that over the winter period, over November, December, January, the reservoirs come up to this level, this sort of 98% level of capacity. But when we have water shortages, we see a rapid diminishing of the contents of those reservoirs. And so we were planning this thing 2 years ago where we were saying, look, we're starting to see water shortages as a consequence of reservoir levels dropping because we've had a lack of rainfall. And then I decided to just have a quick look this year in anticipation of this presentation, and this is where we're at today. So 98% January in terms of Yorkshire water reservoir levels. That green line on the graph is where we are, where we were at the end of May, is at 63%. So we can really start to see that this stuff is happening now. So we talk about it in the National Risk Register as a chronic long-term risk, but the reality is these emerging impacts around climate change are actually with us right now. They're not some long distance future thing that we need to be thinking about. They're starting to happen very, very quickly. These are just some photos I lifted last week. These are 2 reservoirs in Derbyshire. The one on the right hand side feeds Lady Bower, feeds Derwent Res and then down to Lady Bower in the Peak District. The one on the left hand side feeds the Manchester, Greater Manchester area as well. So yeah, just coming back to that point that this is where we are now. These are reservoir levels as we're speaking. Again, climate change isn't something that's going to happen to future generations. It's happening to us right now. I know colleagues, you'll probably see this slide a few times throughout this series of presentations, but I think this is really, really useful. The language that we use in climate change is rubbish. We talk about net zero, which as a phrase in itself is people don't really understand. It's difficult to conceptualize. When I talk about stuff relating to climate change, I try and speak about it in a way that that I can explain it to my mum and dad who are in their early 80s. So what is it that you're on about? If I start talking about tons of CO2 or net zero, they just zone out. Honestly, we've just overcomplicated it. So I think we need to think about not just what we're talking about in terms of climate adaptation and climate resilience. We need to think about how we're talking about it as well. This just illustrates for me the how do we clear this language up. So for me, climate mitigation is about reducing emissions, reducing our impact on the environment. Adaptation is recognizing that if we were to flick the switch and turn off CO2 emissions tomorrow, we've baked in the impacts that are taking place. So for years to come, we're still going to be experiencing those issues. And it really doesn't look like we're flicking that switch off around CO2 emissions anytime soon. So mitigation is around what we're doing to reduce our impact on the environment. Adaptation is how do we recognize that we've already done the damage, but we need to think about flood protection. We need to think about infrastructure and building design in order to keep our operations running, to keep our servers running, to keep our wards cool, to be able to maintain those operations as we see a heating climate, as we see greater flood risk. And then the bit in the middle of the Venn diagram is those measures that we know will mitigate. So if we plant trees, we can sequester carbon. We know that, but we can also provide shading. We can also support water to penetrate into groundwater through that root system. So there are advantages to doing stuff that sits in the middle of this as well, around how do we both mitigate and support adaptation as well. But the key thing here for me is the language. How are we talking about this to make it as accessible to as many people as possible? This report came out in the back end of April 2025, and it's the government's advisors on climate change, the Climate Change Committee, and they published their Progress in Adapting to Climate Change 2025 report to Parliament. I think we took a kicking in health in this report. I think it was particularly striking for me. So main issue taken from this report is that the UK is not adapting fast enough to climate change. But if you take a look at the report, and I've got this link here and I've got further links at the end of the presentation, is you'll see that in terms of the RAG rating for health, where we've got too many reds in there around our preparedness as a healthcare system. And again, this point is being made here. Health impacts are already here. 2022 brought record heat deaths. And we know that we saw excess deaths in the UK and across Europe, particularly in 2022, as we in Lincolnshire, frankly, went over 40 degrees, and we had that period of time, that 3-day period. Interestingly, that South Yorkshire heatwave exercise, we just took that 3 days and what happened in that 3 days, and we extended it over a 7-day period. And really, that's where you start to see the wheels fall off. So NHS specific risks were identified. So in here it says that we recognise that we've got overheating in hospitals, but that's tracked. This is my caveat here, questionable. So I'm aware that we are monitoring to some degree reports of overheating, but to say that we are tracking overheating in hospitals consistently or comprehensively, I'm not sure that that's the case. But it also goes on to say that whether it's questionable within the hospital infrastructure, we're certainly not doing it in GP surgeries, care homes, or in home care. NHS buildings and social care estate lack resilience funding. So for the last few years, we've seen access to quite large tranches of funding around decarbonisation. So the public sector decarbonisation scheme has been incredible. Unfortunately, that's now been withdrawn. But what we haven't seen is any equivalent funding around resilience. And there's a recommendation in this report that we really need to start to see that funding pipeline open up around creating a resilient healthcare infrastructure going forwards. Again, it says there's little evidence of adaptation planning across NHS trusts, ICSs or social care providers, and adaptation is under prioritised when compared to net zero. Without urgent action, climate risk will undermine NHS delivery, workforce productivity and public health outcomes. The NHS must adapt now, not later. Key message from this report. Interesting, I suppose the original Delivering a Net Zero NHS, our Bible really around working around climate issues within the NHS, has a number of sections in it, of which one of those sections is adaptation. Really, I think my gut feeling is that scale should be leveled. I think that should be we should be concentrating on adaptation at least as much as we're concentrating on mitigation, on emissions reduction. So what did we do about it? When I came into post, this is at the back end of 2022, and we started to look a little bit around adaptation. I noticed that a bit of a desk-based study. I noticed that Scotland, the Scottish government, through the Adaptation Scotland programme, and working with a purpose-driven organisation, a non-profit called the Scottish and Northern Ireland Forum for Environmental Research, or SNIFR, subsequently changed their name to Virtue. But the Scottish government back in 2018, that sort of time, were thinking about adaptation. So they've been investing in it. They've got a website. Please check it out because it's amazing, called Adaptation Scotland. And on it, we start to see tools and resources available for public sector, private sector, and examples and case studies that are up there as well. But the thing that really caught our eye on this website was this thing called the Climate Adaptation Capability Framework. So we've been saying within our Green Plan guidance and within our Delivering a Net Zero NHS that organisations need to have an adaptation plan. We're saying this thing's happening, go and write an adaptation plan. But it stops there. There isn't really so what's the process? What does that look like? How do we need to go about that? So we took a decision in the north of England. So our region, Northeastern Yorks, and our sister region in the northwest came together, and we worked with SNIFR on translating their Scottish climate adaptation framework into an NHS context. And we did that we brought together a wide range of representatives from trusts, community mental health trusts, acutes, ambulance trusts, colleagues from ICBs, colleagues from NHS England, and we brought them together and we went through the adaptation framework in Scotland, and we worked on the language and the applicability for what that would look like south of the border. And what came from that was we very much stood on the shoulders of this work in Scotland, but we translated that into this. So Virtue which is Sniffer, and colleagues from Sustainability West Midlands. Both these organisations are incredible, by the way. These are both non-profits, they're both purpose-driven organisations. They worked with us and our colleagues from across the north in translating the capability matrix into this. This is a climate adaptation framework for NHS organisations in England. So what this provides for us is it takes this nebulous concept of adaptation and breaks it down into pathways. So the Scottish capability matrix has been employed by over 50 public sector organisations since its inception, working at place, working across regions. It's been incredibly tested and trialed. So we've learned from those guys. So we've retained the 4 elements of this around understanding the challenge, organisational culture and resources, planning and implementation, and working together. The takeaway from this is that climate change adaptation is a process. It's not just a write a plan, stick it on a shelf. That's the thing that we tend to do. This is a process. This is about awareness raising. It's about skills development. It's about working internally across all disciplines, estates and facilities, clinical disciplines, sustainability, EPRR, into a room to be able to understand the challenge from those different perspectives of expertise, and then to align organisational and culture and resources in order to meet that challenge, to undertake a climate change risk assessment, to undertake the planning and implementation, and then to work together. The working together as well, very much as you work towards that level of maturity, talks about working with partner agencies that are outside the hospital setting or outside the healthcare setting. How do we work with local authorities? Because we can't do this on our own. We have to do this in that multi-agency setting, akin to the way that we work in local resilience fora. I know that Morgan, my colleague from Sustainability West Midlands, is going to go into this in a lot more detail, so I'm going to stop on this now. But please, I would encourage you to take a look at Morgan's presentation on the climate adaptation framework. So we developed this, we published it in draft, and we put it up onto the the Stockholm Environment Institute's We Adapt platform as a draft. And from there, it was then taken by NHS England, and it went through their publications approvals process and actually became national guidance on the 8th of May this year. So and again, these links are live links to the documentation. So for accessibility purposes, in order for people to be able to read it more clearly, a lot of the imagery and graphics are stripped out, but it's the same framework. So so this work from Scotland, we brought it into the north of England. We beat it to death by working with trusts from across the north of England. It then became a draft on the We Adapt platform, and then it went through the approvals process, and this is now published as national guidance for NHS organisations in England, which we are tremendously proud of. Of course we are. It's also part of the recommendations of the Climate Change Committee. It's also baked into there that we should be adopting more widespread and socialising both the climate change risk assessment and the NHS climate adaptation framework. So again, tremendously gratifying that it's recommended as good practice within the Climate Change Committee report. We're currently going through a process of Green Plan refreshing. So original Green Plans for NHS organisations were for 22 to 2025. We're now in 2025, so we're now doing the 2025-2028 revision of those Green Plans. And Green Plan guidance came out earlier this year to help systems and individual trusts in their work around reshaping their Green Plans. And again, it's great to see in there that there is more directed recognition of adaptation as part of their Green Plan. The interesting thing for me is that it brings in EPRR. I think traditionally adaptation has been seen as, well, that's their job over there in sustainability. The way the Green Plan guidance is written recognises that it's more than just one person's job or one team's job. It also needs to bring in core standards around EPRR. And climate risk has been part of the NHS core standards from that EPRR submission. I mean, back in 2019, the deep dive within there was around climate adaptation, but it's more now about how do we work together, go back to the adaptation framework, how do we work together internally to bring that multidisciplinary approach to be able to do comprehensive climate adaptation planning. Okay. This is something that I find constantly fascinating. So this is about us as messengers within the healthcare system. So this is an Ipsos survey, it's their veracity index, and the question asked is, now I will read you a list of different types of people. For each, would you tell me if you generally trust them to tell the truth or not? And this is percentage trust to tell the truth. And if you look at this, we can see that nurses, engineers, doctors, professors, teachers, top of the pops. So messages that come from ourselves and particularly our clinical colleagues are trusted by members of the public. I think we're living at a time where even the phrase net zero is being weaponized as a phrase and being used as a stick to beat organizations and systems with. We need to push back against that narrative. Part of that pushback, I think, can come from our own colleagues because we're trusted voices within the community. It's really interesting at the bottom here, bottom of the list, politicians generally, 11%, government ministers, advertising executives and journalists. So I think in terms of carriers of that message, we need to recognise within the healthcare system that our voice is trusted. I think we need to utilise that. So a few conclusions I just want to draw from this presentation. I speak to people all the time about climate emissions reduction, and I speak to them about adaptation. The thing that I notice though is I speak to a lot of the same people. So I think that we're talking to ourselves. I think that we need to, we need to break out of the echo chamber. The same voices nodding in agreement won't shift the system. Who's missing from the conversation? So go back to the trusted voices thing. How are we speaking to our colleagues? How are we speaking to our family members? How are we using our voices to speak to people who aren't cited on this, as you are, who are watching this presentation? Second thing, going back to the fires on Saddleworth Moor and our reservoirs, it's not a thing that's coming, it's already here. And we need to be doing stuff about it now. We need to be introducing more urgency into this because climate disruption is already impacting health. It's not something that's happening in a far distant future. And as the Climate Change Committee have pointed out, we're not doing very well on this as a country, but we're not doing very well on this in the healthcare system. Adaptation isn't a destination, it's a process. So it's not good enough to just do a risk assessment and write a plan. It's a process. It's a process. So the NHS climate adaptation framework is very much that. It's about making your way through a process. It's about making sure that people are cited on this, are understanding of this and the implications of it. But more importantly, how do we encourage colleagues with their knowledge to participate in the solutions? Because the solutions are there as well. Stole that bottom right hand circle because I used to be a health and safety practitioner as well. So the Health and Safety Executive used this Plan, Do, Check, Act. The point of this is about continuous improvement. So we need to undertake our risk assessment. We need to put our plans in place. We need to test them in anger. But again, we need to learn the lessons and then we need to fold that back into increasing. As we iterate those plans, we need to improve them as they go forward. So these are not static documents. But again, the issue is it isn't a destination, it's a process. The last thing on here is I think we don't recognise the power that we have in that we are trusted voices. So clinicians, and I'm speaking to some researchers on this call, public servants are still among the most trusted people in society. And if we don't lead the conversation, others will, and they may not have the public interest in heart. And I'll leave you to interpret that however you want to interpret it. And my last slide is this one. Hope it's okay, Louise, if you want to put this out. this has got just all of the links to what I've been referring to. So the first bit is the first published climate adaptation framework. It's a bit boring. If you want it in splendid Technicolor, go to the Stockholm Environment Institute, and all of the guidance that sits underneath that is there. So yeah, thank you very much, and thanks for the opportunity of speaking today.
Thank you so much, Neil. That was a delight as ever to hear you speak, and what a great way to end the first of our webinar series. So thank you very much.